So, I want to talk to you today about how hormone replacement therapy and birth control can actually make all of your symptoms worse. So, I see people popping on. If you're hopping on, let me know where you're joining from in the comments. I live in Vancouver, Washington. It is the weather is changing here and we have started school already. So I would also love to hear in the comments if you're homeschooling, are you distance learning? How is all that going? How is your stress level? Let's just do a quick body check because stress is real, you guys, and it will wreck your hormones. So, okay, how hormone replacement therapy and birth control can actually make your symptoms worse. So, this may be news to you, but all of those symptoms that you're having, which let me know what symptoms you are having in the comments: painful periods, heavy cycles, migraines. Hey, Sarah, Wisconsin. Wow, that's awesome. So glad you're here. Painful periods, heavy periods, really anything more than like one day of a moderate to heavy flow, I would consider not normal. So, and I'm going to be working on something to kind of train you guys and teach you what is normal and what is not normal about your cycle. Sarah says, my kids and I are all doing virtual learning. Are you teaching as well? I feel like I remember having this conversation with you, but maybe not. So, okay. So all of those symptoms you're experiencing are symptoms of an underlying hormone imbalance. Madeline says, my stress is running over. I'm apologizing to my kids a lot more these days. I 100% get it. You need to schedule some time for yourself, even like a 15-minute walk around your property or a bubble bath or something to get the stress out of your body. So when we move, it actually physically gets the stress out of our body. So just a really quick tip there for you. So a hormone imbalance essentially is an imbalance in any of your hormones that leads to heavy periods, mood swings, insomnia, hot flashes, endometriosis, PCOS, and more. So many of the women in this group have done, lab testing. You have, yeah, let's do it. Let's do it, Madeline. That'll be awesome. I need time with you too. So let's see. Sarah says, I run an in-home daycare, but I'm going back to school myself. Oh, thank you. Yep. You're amazing, Sarah. That's phenomenal that you're doing all of that. Okay, focus on the notes, Andrea. So all of those hormone imbalance symptoms that you're having are a hormone imbalance, whether they show up on the labs or not. So I'm not going to go into lab testing because I have a whole hour training on lab testing, the ins and outs, the complexities, what you need to know. You can type in the search bar lab testing and all of that's in there for you. So a hormone imbalance can be caused by stress, infection, underlying food allergies, thyroid disorder, gut dysfunction, due to antibiotic use or a standard American diet, lack of sleep, head injuries, even pregnancy. Pregnancy actually will change the shape and the size of your pituitary gland, and it doesn't always bounce back right away. Your pituitary gland is what controls, how much thyroid hormone you're producing, how your endocrine glands are doing. It communicates with every other cell in your body. So these are some things that can trigger hormone imbalance. How many of you have noticed that your hormones have actually gotten worse after a pregnancy, after an infection of any kind? It can be even just a really bad cold, or after antibiotic use. Let me know in the comments. Great, we all know I've been pregnant. It's okay, Madeline, I have some tricks for you, don't worry. Okay, so unless we correct the above issues, the hormone imbalance will not resolve itself, okay? It's like driving in a car and refusing to fill up the gas tank, even though it's like sputtering and making all of these noises, right? So your body is telling you, it's waving the red flag saying, hey, I need your help. Give me some TLC. And when we don't listen and we do something to our bodies that is not helpful, like hormone replacement therapy or birth control, it's actually shoving that problem deeper. Now, how many of you have ever shoved things under a rug, literally, or if you were like me as a kid, you shoved everything under your bed and you hoped your mom would never find it? And then when you're forced to clean your room, you pull it all out and there's some like moldy food in there and some like funky socks. And tell me that's not just me. I was that child though. I'm just going to say that. So that's what happens effectively when we don't treat our hormones at the root cause. Okay, so unless we correct the above issues, those hormone imbalances will not resolve and they will get worse over time, especially if we add hormone replacement therapy and birth control. Standard treatment for hormone imbalances is to treat the symptoms with synthetic hormones in the form of birth control, patches, shots, or creams, or by addressing your mood with pharmaceutical medication rather than understanding that your hormones operate in communication with every other hormone in your body. So by treating one hormone, you're not getting to the root issue and you're not helping all of the other hormones in your body that rely on that one hormone to function. So while some of these methods may eliminate some of your symptoms for a short period of time, they aren't dealing with the root problem of the hormone imbalance, which is gut issues, poor liver function, stress, poor sleep quality, inadequate hydration, infections, etc. That's like the super short list, okay? These methods like hormone replacement therapy, birth control, also don't take into account the fact that your hormones work, again, in conjunction with every other process in your body. So eliminating one symptom with medication means that the other symptoms are going to crop up somewhere else. It's like playing whack-a-mole. How many of you have felt like you've been playing whack-a-mole with your hormones? You try a supplement, it works for like 3 months, and then you're back to square one. You take a hormone replacement therapy, and it works for 3 months, and you're back to square one. Or you take pharmaceutical medication, and it helps with your mood, but it kills your libido. Like, I want to know in the comments if that's you, if you have experienced, and you're tired of it. I know that I was, so I can certainly relate to that, okay? When the root cause doesn't get taken care of and the symptoms are shoved deeper over time, symptoms get worse, which often leads women to needing more aggressive treatment like a hysterectomy, removal of ovaries, or other long-term therapies that are harmful and can make your hormones worse over time. So I went on birth control with no discussion about side effects from my doctor. So while it proved to be effective in preventing pregnancy, it came with a whole slew of other side effects like nausea, bloating, crazy irritability, like almost bordering on rage around that time of the month. It got to the point that I became super controlling and angry, and I was a newlywed at that time. I didn't want that for my marriage, How many of you responded that way to birth control? I'm just curious because I know for myself, I did, and I really didn't know that that wasn't necessarily a good sign and that it was actually affecting my neurotransmitters and their ability to communicate with each other, which was causing these terrible mood swings, okay? Okay, so it wasn't until I got legitimate help that addressed all of the underlying root causes, gut, liver, stress, sleep, etc., that I began to see improvements. So I know that many of you in here, you're brand new or you've been following me for some amount of time, and you have maybe tried a few things to help your hormones. But when we don't have all of the pieces together in a process that works together, we often end up getting a very partial healing. And so that's a lot of times what's missing when we work with a conventional medicine doctor or even sometimes a functional medicine doctor, where, again, they're chasing symptoms with supplements, and that's not ideal because it's not getting to the root cause of the issue. So what are the risks of hormone replacement therapy? So these are super easy to search and find. Sarah says, I have never taken it because I didn't know what it would do to my system. Birth control. Yep, makes total sense. Okay, so these are super easy to find. You can Google like scholarly articles on hormone replacement therapy, etc. If you want those studies, I'm happy to pass them on to you. But just some of the risks include hip and vertebral fractures because of the depletion of minerals that happens, vaginal bleeding, urinary incontinence, dementia, That's not a small symptom, you guys. That's a big deal, okay? Stroke, blood clots, and heart attack, which we know because there have been some lawsuits from birth control in the past. Breast cancer, and over time, when these symptoms are not dealt with, again, by dealing with that root cause in a systematic way, your symptoms will gradually get worse, okay? So let's take Janet, for example. She had hot flashes most of her life, mood swings before her cycle, and was developing endometriosis. Her general practitioner put her on antidepressants for her mood swings and recommended a hysterectomy for her endometriosis, letting her know that it would solve all of her unwanted problems, but never talked to her about how it would impact her future health, okay? So 5 to 6 years after her hysterectomy, her symptoms had only gotten worse. Her labs were normal, but she still felt terrible. She was waking up 5 to 6 times a night, was having mood swings and debilitating anxiety, and the root cause of all of it was this underlying hormone imbalance that had led to the endometriosis and the hot flashes in the first place. Okay, so we began working together, and within 2 weeks, her hot flashes were gone, like 0 of them. They were not happening. Her sleep improved and her mood began improving as well. So this is what happens when we begin to look at the body as a whole and we treat it as a whole. So we're no longer looking at, oh, you're having mood swings, we need to give you antidepressants. Oh, you're having mood swings, let's make sure your liver is detoxifying properly, and let's make sure that your gut can actually communicate with your brain, because if it's not, that's a really big problem. And we want to get that connected so that you're healed up, you can enjoy your family, you don't have to be snappy mom anymore, you can be happy mom, and ultimately so that you have all the tools that you need so that when you get into menopause or perimenopause, it's like a breeze. You don't even have to worry about all those other things that your lady friends are worried about. So if you want to dive into this process with me, you want to find out if this process is for you so that you can get rid of your symptoms, and I want to invite you to schedule a breakthrough call with me. So these are strategy calls. They're completely complimentary, and my goal is to figure out where you are stuck and what you need to do to move forward. So if that's you, then just drop an emoji, a little waving hand emoji, or say that's me. And I will reach out to you and make sure that we get you scheduled. And we can also dive in a little bit deeper into the other secrets that I was going to share on the masterclass today before my internet broke. So if you have any questions, please pop them in the comments and I'd be happy to answer at a later time. Thanks so much for watching.